Hello everyone. So in this video we are going to talk about Syringomyelia, important cause for chronic progressive myelopathy. Syringomyelia is derived from the word syrinx, that is a fluid-filled cavity. As you see in this image, we have a fluid-filled cystic cavity within the spinal cord. This syrinx develop either in the lower cervical or the upper thoracic region. If this expands into the medulla and the brain pons, it is known as syringobulbia. The pathogenesis of syringomyelia lies in the fact that 50% of patients of syringomyelia have Arnold-Chiari malformation. That is, herniation in Arnold-Chiari malformation, we have herniation of cerebellar tonsils through the foramen magnum that is enlarged. Now, this cerebellar tonsil herniation leads to a pulsatile CSF pressure wave that is transmitted to fragile tissue of cervical cord as well as brainstem. And this continuous pulsatile wave that reaches the cervical cord and the brainstem causes formation of a secondary cavity. And this secondary cavity formation near to the cervical cord and brainstem leads to destruction of the spinothalamic neurons, anterior horn cell, and lateral corticospinal tract. And this is what leads to a progressive myelopathy in a patient of syringomyelia. And this too leads to classical clinical features of syringomyelia, that is, there is central cord syndrome involving more of the upper half of the body, there is dissociated sensory loss, and a areflexic weakness of the upper limb. Now this dissociated sensory loss is given a term that is cape-like distribution. Generally starts from the it starts unilaterally involving the nape of the neck, the shoulder, and the upper arm. This resembles a cape that was worn by warriors to protect the area of the cape. And this distribution is known as cape-like distribution of sensory loss. Also, we have neurogenic arthropathies that are common in case of syringomyelia. Neurogenic arthropathies are most common in case of shoulder, that is known as Charcot's shoulder. As you see in this image, we have Charcot shoulder. We see atrophied or the head of the humerus as well as the glenoid cavity is not visible because of destruction. Also, neurogenic arthropathies leads to thoracic kyphoscoliosis. Another feature in syringomyelia is lamine succulentae of syringomyelia. Here we see thickening of the subcutaneous tissue with swelling of hand, as in this image. More one sign is progressive loss of pain sensation, loss of soft tissue, leading to resorption of phalanx. MRI scans are what delineate the syringomyelia, showing clearly the fluid-filled cavity within the spinal cord, as you see in one of this image. Treatment is by posterior decompression of Arnold-Chiari malformation or coperitoneal shunting for drainage in case of increased pressure. This was a bit about syringomyelia. Hope you liked it. Thanks for watching.